Thanks, Michael. Thanks, Katie, for getting those slides up. A really big hello to everyone. I'm from VODG or VODG, however you want to pronounce it. I'm the new head of policy, and I've been in post for 3 weeks. So it's really lovely to meet you all. And this is my first big event, so very exciting. And I've seen the agenda. We've got some really good stuff coming up. I just wanted to give you, for anyone who doesn't know, and it's always helpful to, I think, go over these things anyway, just a bit about the background of STOMP STAMP. So as Ronnie said earlier, and as you can see, we're focusing on the essential role of the health and care workforce in reducing the reliance on psychotropic medication. And you can see the partners who we're working with there, NDTI, LDE and Skills for Care as well. Whatever project we go into, we always focus on trying to work with partners in collaboration. So a bit about VODG. So we're a membership body for disability organisations who work with disabled people, and altogether I think we represent over 84,000 staff and over 1 million disabled people as well. Next slide, please. So STOMP, the stopping over medication of people with a learning disability, autism or both, and STAMP, supporting treatment and appropriate medication in paediatrics. Next slide, please, Katie. Thanks. So why is this project so important? So at VODG, we're involved in quite a number of different projects, really focused on health inequalities and improving health for people with disabilities. STOMP STAMP, this is so important because up to 35,000 people every day in England alone, so not just the whole of the UK, in England alone, with a learning disability, autism or both, are taking prescribed psychotropic medication without appropriate clinical justification. So as you'll know, where there's a big group of people taking a lot of medication, that's something that we would always need to look into and make sure that that's being done appropriately and correctly. But we know that this is being done without appropriate clinical justification. And further to that, a report in 2020 showed that almost a quarter of people of all people with learning disabilities who died were on antipsychotic medication, of which 8% were on 2 or more of these, which is in contradiction to advice from NICE. Now, this is obviously huge because NICE have their guidelines for very specific reasons based on research. We know that psychotropic medication can alter how we feel, how we see things, our level of consciousness. And we know that there are situations where, you know, we will take medication, but long term without clinical justification and in a way as well that's been advised against. That's why this project is so important. So at VODG, so we've always had a strong focus on health improvement and tackling health inequalities with the people that we represent. So we've done that for years. We do that in 2 ways. So first of all, we're an advocate. So we speak to government, we speak to stakeholders and partners to champion that agenda, that voice, and make sure that when the decision makers, whoever the decision makers are, they act with disabled people in mind. So we do that on one hand. On the other hand, we also provide practical resources for providers, because it's one thing having a conversation and trying to talk about how we can improve a situation. Actually, it's the people on the ground who deliver these support services who are absolutely fundamental in addressing these issues. So we have that 2-pronged approach at VODG. And you can see here what's already happened in terms of the STOMP STAMP agenda. And I'm shortly going to be handing over to Katie, who's going to be talking a bit more about the aims and objectives of this specifically. but we've already got cracking on this. So we worked with NHS England on the introduction and rollout of the STOMP agenda for the social care provider sector. So you may have been involved before. This may be your first time involved today. The key thing is we've tried to, along with our partners, unite organisations and show what is possible, that this situation isn't inevitable, and to look at how we can improve it as well. So some of the things that have happened are creating a pledge for providers to sign up to reduce, to take part in the STOMP STAMP agenda. We've co-produced resources already, including a stamp card game for support staff, and importantly guides as well, so that those people who are working directly with the people we support, they can they have that in front of them, and they know what good looks like, and have that background as well. So that's a little bit about the STOMP STAMP agenda. Katie, have you got the next slide? Yeah, perfect. So I'm going to hand over. Thanks for listening to that little introduction. I'm going to hand over to Coral, as we're going to be hearing a video from, as you can see, family carers perspective. Tracy, thanks.
Hello, I'm Coral. I'm from the Challenge Your Behaviour Foundation, and we are a charity that works with people with learning disabilities, with severe learning disabilities and behaviours that challenge. We work with a lot of family carers, and over medication is an issue that comes up numerous times. And one of the family carers, Tracy, has kindly videoed herself speaking about her experiences. Unfortunately, Tracy can't be here with us today. She's just emailed me to say her support worker, she was hoping to come along, but her support worker is off sick. No cover. That's the reality of being a family carer. So I'm just sharing Tracy's video. But what I'm mindful of is we're recording this meeting, and Tracy hasn't given permission for that. So I don't know if we can stop whoever. Can we stop the recording just while we're showing this video?
So obviously Tracy's video shows how important the health and social care staff in delivering the STOMP and STAMP agenda, and that's what we really want to explore through this piece of work. So we want to explore the potential and identify opportunities to embed STOMP and STAMP across the health and social care workforce, and ultimately leading to reduced reliance on psychotropic medication for people with a learning disability and autistic people. Our three objectives are firstly to gauge awareness of STOMP and STAMP amongst the health and social care workforce, then to explore the barriers and challenges to using STOMP STAMP across different health and social care roles and settings, and then to identify opportunities and solutions to improve awareness and ultimately reduce reliance on psychotropic medications. In order to achieve those aims, we've set up a reference group made up of people with learning disabilities, autistic people, and family carers. They're kind of helping us to shape and steer the work, and we've spoken with them to help them shape our methodology and the questions that we're asking, and we'll kind of speak to them to look at the evidence that we've gathered when we've done that, and look at solutions and key learning from that. In terms of intelligence gathering, we've got a few approaches. So we've got a questionnaire for health and social care staff and family carers. We're also doing some focus groups and conversations with stakeholders, which will look at sort of the barriers and the solutions in more depth. We'll then analyse all of the evidence across those activities together with our reference group to identify key learning and solutions. I'm going to pass to Lynn now, who's going to ask a few questions and then talk about our first meeting with our reference group.
Okay, thanks. Thank you, Katie. I'm going to try and do something clever, and so please be kind if it all goes terribly, terribly wrong. As Katie said, we do have a reference group, and they are the experts on this. And when we started, it was really important that they were able to steer the project, and that we were able to ask the questions that they thought that they were important. And so in a little while, I shall tell you some of the things that they said to us. But before I do that, I thought that it'd be good if we could ask you what you think. And this is the clever bit that is bound to go terribly wrong. And what I'm going to ask you to do is, if you have a smartphone with you, if you can just put in slido.com into a search engine, and then you should get up a screen that has this kind of blue bar thing here that says joining as a participant, and you'll be asked to put a code into it. If you don't have a smartphone and you have access to the chat, I'll also be saying what the questions are. And if you just put your answers into the chat, then between us, kind of Kate and I are going to try and do 3 things at once and put your answers into this poll thing so that you aren't left out. But for everyone else, oh my God, you're beating me to it, because I can actually see Slido on my screen here. And the first question was actually, have you heard of STOMP and STAMP? And so anyone that can't get to Slido, if you can just either put yes or no into the chat, and the question is, have you heard of STAMP, STOMP? And then just put in yes or no. Okay, thank you, Lisa. There's another yes there. I'm gonna try to put, or Katie's gonna put your answer into the Slido. Kind of so far on the online poll, we have 88% of people who've said that they've heard of STAMP and STOMP. And we have 12% that say they haven't heard of STAMP and STAMP. And we've had 17 people answer. So I'll give you a few more minutes to have a go, either in chat or on the Slido. Normally I'd have this coming up on the screen, but I thought if I try and do that into the PowerPoint, then it will definitely go terribly wrong and we'd never get anywhere. So I'm just going to leave this poll open for a couple more minutes. Oh, the Slido code. Okay, yes. I don't know if you can see the screen, Lisa, but all you have to do is in a separate tab, just put kind of slido.com and Slido will come up. And then you should see the blue bar that says joining as a participant. And then the code is just, it's a hashtag, which is like 2 lines down, 2 lines across. And then it's 3831910. And that's hashtag 3831910. I'm going to be asking 2 more questions and they all have the same code, but really sneakily, I've only actually opened one of the polls yet. Okay, so, oh, you've logged in. Okay, perfect. So Lisa, I'll just give you another second to answer, and then I'll go on to the next question. Okay. I'm going to do 3, 2, 1, and I'm going to open the next question. Okay. And so the next question you should be able to see is, what does STAMP mean to you? And there's loads of you typing away, and either just put in one word or a really short phrase, and it should let you. Okay. And there should be forming a beautiful word cloud where it isn't. It's actually displaying in a list, but that's okay. This is all really interesting and really helpful. And all of the stuff on here will all actually really help to enrich our findings, because we're going to use absolutely everything. Okay, and so 12 people have had chance to put kind of something in around what kind of STOMP and STAMP mean to them. And there's 5 more people typing, so I'm going to give you a little bit more time. There's 4 more people typing again. If you can't get onto the Slido, then just put your answer into the chat on here. And the question is just, what does stamp and stomp mean to you? And then we'll include your answers in the Slido poll. And at the end of today, I'll send through the results of this so they can go out with your minutes so you can all see what was actually said. Okay, there's just still one more person typing. We've had 19 responses so far. There's 2 more people typing. So I'm going to give it a couple more minutes and then I'm going to go on to the final question. Okay. Ooh, one person's typing. I'm going to let you keep typing for a little longer. Then I'm going to do a 3, 2, 1. You're still typing. Okay, you've stopped. So I'm now going to go on to my last question. And 21 people responded to that one. Thank you. And this one is a bit of a multiple choice. Come on. All right. It's going to be harder for anyone that's trying to use chat, but I don't think anyone is. And there's a multiple choice here. And there's, whoa, that was fast. Like there's 3 options. And these are actually kind of based on the aims of Stomp and Stamp. And the first one is, have you encouraged people to have regular checkups about their medication? The second one is, have you ever encouraged doctors and other health professionals to involve people, families and support staff in decisions about medicines? And the final one is, have you informed others about non-drug therapies and practical ways of supporting people so they are less likely to need as much medicine, if any? And that was a massive mouthful, so I do apologise for just like blurting that out if you can't actually see it. Right. Again, 21 people have joined in there. And kind of thank you. And as I said, we will send the results out to you and they will go into our findings. They will inform our findings as well. And so what I'm going to do next is go over to what the people in the engagement group said before you can have a chance to talk. So can you change the slide, please? Perfect. Okay, so this is a bit small. I hope you can see it. And so the first one, let me just ask the question, why are stamp and stamp kind of so important? And our advisory group said that. Everyone said it's just like really important to help for people to have good health. Then stopping the over-medication of people is just absolutely essential. And it could save lives. And we actually struggled to try to get the advisory group together. And part of the reason was lots of people with a learning disability and autistic people said to us, we only want to get involved if this is actually going to make change and make change happen. And the reason they said that is like they've all been involved in lots of things over the years, and they were getting frustrated because they felt that nothing was happening as a result of all of the stuff that they were trying to do. And so we're incredibly grateful that they agreed to help us with this project, because it is, as Tracy can describe so eloquently and so calmly, incredibly important. It's about people's lives. And so when we asked the advisory group what they wanted the project to achieve for people with learning disabilities and autistic people and their families, the most important one was to be listened to. As a result of all their activity, as a result of them giving up their time, kind of guiding our project, they want something to happen as a result of what they say. And so Thank you so much for letting us come along to your meeting. And thanks so much for helping us to hopefully to stop the over-medication of people, basically. And that's all I'm going to say, because we want to hear from you guys, because you're the ones that can help to make that happen. Thank you.
Just quickly before we go into breakout groups, does anyone have any questions on anything that we've talked about so far? Just checking the chat. Okay, that seems good then. Michael, are you okay to split us into our breakout groups now? We're going to discuss the question that's on the slide here. What makes it difficult or challenging to implement STOMP and STAMP? And particularly, how can we overcome those barriers? So we just really want to hear your experiences and your views of learning about using STOMP STAMP, whether you've seen it being used, your kind of reflections on what's worked well and what are the challenges that you've faced. And please do share any examples of good practice that you've seen or that you've used.
And if I can just say, we're going to spend 20 minutes in the breakout groups before we come back to feedback.
Thanks.
20 minutes. So, and so am I right in saying, Katie, that the ambition is that each group will come out with 3 key barriers and 3 key solutions?
Yes, yeah, that's right. Thank you. Yeah, so we'll have a facilitator in each group, and they'll also be trying to note take unless we have any volunteers who would like to note take and report back. And then, yeah, we'll report back on three key barriers and solutions, hopefully, to those barriers in particular.
Brilliant. Okay. So yeah, all being well with technology. Are we okay to open the rooms?
Yeah.
Okay, cool.
Do you want to first, Lynn?
Sorry, Katie. Yeah, okay. So that was a really interesting, really informative session. Everyone in my group was very aware of kind of STOMP and STAMP. You know, people had training, they've been using it for a really long time. I'm going to cut right back, right down to the chase, really. And I'm going to go straight to solutions as to why and how kind of STOMP and STAMP may be kind of used more intentionally, I suppose, is the word. And a really big message that came out is that there needs to be someone to take responsibility and to provide leadership and to make sure that kind of STOMP and STAMP happens. And someone needs to be accountable. We had a discussion around how the use of kind of STOMP and STAMP has to be really intentional. It can't just be that you do as part of your kind of normal practice because you do medication reviews. It has to be very, very intentional for it to work. Like there are pockets of good practices, there's good stuff going on, but like the general feel was that it tends to be quite localized, and there isn't that in the intentionality. And we've got a kind of 4-step solution, which we think may help to make it kind of more intentional. Because the first one was just around awareness and communication, and something really simple that could happen is that kind of STOMP and STAMP information that could be sent out alongside kind of patient kind of clinic appointment letters, and that would keep kind of STOMP and STAMP just there on the agenda. And then in places like surgeries, wherever, just have information about kind of STOMP and STAMP available and really on show, on view, so people can see it, so it's just always there. Because something that could really help to make it happen is to make sure that kind of populations are known. and to audit and re-audit, kind of find out who's out there, kind of find out kind of how many people are on psychotropic medication who don't need to be, who don't have any kind of mental health diagnosis that it would be appropriate, for that medication to be prescribed for. And even if they do have the diagnosis, re-audit, are they still on it? Why do they need to be? And then something that could make that happen would be to have targets around like the reduction of medication. And then if people haven't reduced medication in the well-known identified populations, then they need to say why. Why not? Why hasn't it come down? As opposed to just being able to fill in the form. And then that information could then go back to an executive board who could keep an eye on it, and they could go to people and say, why have your numbers gone up? Why is this happening? Okay, real whistle stop tour. Does that sound about right? I'm sure that I've missed loads of things out. The people that were in my room. So in 10 days, Sanjay, Tanya, Teresa. Have I missed anything crucial out? I'm sure I have. Please shout out if I have.
I think you covered it very well then.
Okay, thank you.
No, you can't on that screen.
Okay, if you do think of anything, then please do add it into chat. And I'm going to go on mute again now and hand over to whoever wants to feedback next.
I'm happy to feedback next. So our breakout room didn't record, it wouldn't let us. So I've tried to take as many notes as possible, and I'll get that written up and sent through after. So yeah, likewise, anyone in my group, if I say something that's wrong or I just completely miss something, please do shout and join in. So we spoke about, so the people in our group had a much lower level of awareness of STOMP STAMP, and actually they'd come along today to find out more about it. So we really focused on what are the barriers to that awareness in the first place. So for example, one of the people in our group is the school nurse, and so we spoke about the importance of having a wider awareness of STOMP STAMP that isn't just down to the people who are directly involved. But we spoke about a culture of, I think we summed it up as advocacy and accountability, so that everybody involved in a situation that may affect somebody with learning disabilities or autism, they're all looking for that accountability and that advocacy. So we spoke about health checks. And one of the reasons why medication can increase is because health checks are quite often put off, and it's often down to people self-advocating that they want to look at their own medication. And we said, well, what if somebody isn't in that position that they can self-advocate? And we spoke about the difficulty in getting GP appointments and those appointments where you would look at this. So we spoke about everybody being involved, from people supporting in the school to wider as well, and that came across as quite important. So when we talked about how can people know more about STOMP STAMP, it was, as I said, not just those people directly involved, but all of the people who should be involved in the conversation around it as well, and can say, have you looked at this? Have we, are you making sure that we're implementing these aims? We also spoke about as well, I think one of the big problems is whose responsibility is it? If, for example, a support worker might leave, or if a family member changes over, or all of the people in that circle, and a GP doing that health review but not doing it, whose responsibility is it ultimately? And then we spoke about the barriers. I don't know if we've gone off on a bit of a tangent, but the barriers to actually getting those checks. So where you would be looking at your at how much medication your family member has or you're having. And we spoke about things like barriers to going again back to the GP. So going to breast screening, for example, to have a mammogram, but you would have to stand up. And what if you can't stand up? What if your family member can't go to new places? They really struggle with that. So we're looking at how can we bring things back into care homes where possible. And I think that's, and we did speak about as well, where are the opportunities to really get STOMP STAMP in, and particularly, for example, with nurses and with school nurses. And we looked at that initial training and then the ongoing training as well as part of modules, so that it's structured. So I think that's what we covered from a kind of just hearing about it point of view. So hopefully that's helpful.
That still seems really great to me. Thanks, Lucy. Yeah.
Shall I go?
Yeah, go ahead.
I've got some good conversation. I'll try and relay the key points as succinctly as I can. But there was some really good points, particularly from Ronnie in regards to what he labelled shutter-uppers. So if you have a learning disability and you're sort of having some struggles in life, then the first course of action often is then going to a GP or some sort of other doctor, and then first course of action could be a prescription, and therefore one key solution is being treated as an ordinary member of the public, where you wouldn't ordinarily make those decisions or not so quickly. So avoiding shutter-uppers as being your first port of call was a key message, I think, from Ronnie. Some really good messages about education and information, and in particular education around supporting or having engagement with people who don't use verbal communication as their first language. So people generally, but particularly within professional services, having training in how to engage with people who don't use verbal communication, or it's quite limited. And of course, the age-old story of people having good quality communication and hospital passports, and people actually making use of those, reading them, which would be really useful. And then I think another key point was people feeling and being empowered, people knowing who they can turn to for advice, for information, and for people with learning disabilities and their families and advocates feeling empowered, feeling listened to. Families and the person with a learning disability know their lives, know their situation better than any professional. So ensuring that people are listened to. Was there anything else from Ronnie, Lisa, etc.? Anything else?
I think you covered it all, really. You done
Cool.
well.
Thanks, Ronnie. Who's next?
I'll go next. So our group raised some of the stuff that's already been raised before. I think one of the things that we talked about was how to kind of look at alternatives to medication, and a big part of that conversation was around people living in good environments with staff that kind of know them well and support them well. Active support, kind of being engaged in activities and things that kind of make them happy and improve their well-being, and how important it is to consider all those factors when you're looking at medication. And then that kind of led on to thinking about, in terms of medication reviews, how important it is to have the people that know about those factors. So having support workers and families involved in medication reviews to make sure that those things are looked at, but also thinking about some of the kind of wider issues that prevent that from always being the case. So things to do with staff shortages in the care sector and those sorts of things. We also talked about needing a multi-pronged approach, kind of looking at everyone's different roles and responsibilities within this and the different kind of approaches that they'll take. So in terms of some people, sort of medical professionals taking a medical model approach, and that's kind of why there's this focus on medication, but kind of needing everyone to be involved so that the focus isn't on medication, but is on those wider aspects of health and well-being as well. And then there was a lot of talk also about education and improving education for social care staff. So we talked about kind of education in terms of understanding what the risks of kind of inappropriate use of medication are, and that sometimes staff just haven't been told about this before and are not aware of it, but also in terms of challenging medical professionals and the kind of understanding that you know, GPs, if they've prescribed something, then they kind of don't feel that they're in a position to challenge it, but actually we kind of need to change that and provide education to empower people within social care to kind of advocate for the people that they support in that way, but also education for general practice in terms of challenging those and changing that medication as well. I've definitely missed something, so if anyone from my group wants to say anything, please do.
We talked a bit about appropriate environments for people. Sorry, did you say that, Katie? I'm not sure.
I talked about being placed in a good environment, but
yeah, you know, we were talking about how increasingly now the idea of somebody, you know, being supported in an environment that absolutely works for them is becoming less and less. So people, you know, we have voids in a residential service, for example, and so let's fill the void, even though actually the person really needs a single person service, for example. So it's almost like if you haven't got the basics right, how are you then going to be able to reduce medication? Because medication is dulling the pain, so to speak, because actually the person doesn't want to live where they're living. So getting the basics right, we thought was pretty important.
Yeah, thank you. Unless anyone else. Yeah, we've got Kate as well to feedback. Hi.
Hi, thanks. Loads of similarities, as you would expect, really, with all these clever people. We're a small select group of three really experienced colleagues, actually, who are doing amazing, interesting stuff, which I think actually be really good to follow up with you all after today. So yeah, without trying not to repeat, a key barrier was really GPs not confident to overturn really a prescription that's been given by a consultant, for example. So when somebody's discharged, the GP can kind of leave them on. They're very cautious about changing the prescription, so we'll leave them on the antipsychotic medication, for example, or other medication, you know, epilepsy medication, for example, sometimes for years without actually reviewing it. Somebody's got their mic on. Similarly, support workers and residential managers don't really know why people are on the medication, and nobody challenges it because they've just been discharged with it and they just can stay on it for years. So problem about confidence, really challenging what people are on. So a role then for training those staff, and we heard about for example, we heard about a role for learning disability nurses in community LD teams and LD nurses in acute hospitals, etc., in kind of doing med reviews. So if as soon as somebody gets referred to them, they do a medication review and then they take appropriate action. So they refer back to the GP or whatever. And we also heard that actually they find if a GP's not done a check, including a medication review, then they report them to CQC, which I thought was rather marvellous. The LD team, this is. Similarly, we heard about an audit in London, audit of patients, where they looked at all the people on the primary care register to see how many are on psychotropic medication and how many actually shouldn't be because they haven't really been diagnosed with a mental health problem that's appropriate for that. And they found that 50%, I think, Penny, you will, Shiva, you'll correct me. Doing audits, so training for primary care, training for the residential support workers, and actually doing some kind of audit work, which would show that in this surgery, they've got however many % of people who shouldn't be on this drug. So lots of examples of good practice, which I'm now going to draw to a close because I'm really mindful of the time. We're already overdue. I think it was great, and I think it would be really good to follow up with you three, if you don't mind. I've finished. Thank you very much. Have you got anything else to add?
Thank you, Kate. I was just going to say the audit was in Newham, and it was comparing how many of the STOMP eligible patients in primary care and the learning disability register were under the learning disability service, and it was only 50%, around half. The rest were just being covered by the GPs who lack confidence in doing these medication reviews, which is highlighting kind of the inequalities that some service users can face borough to borough.
Yeah, and you do training, Shiva, just to finish that off with for primary care. And we talked about it being about understanding LD generally, didn't we? So it's not just about over medication, because what we saw from the video, it's actually much more than just the over medication, isn't it? It's about a kind of general, kind, person-centered care, isn't it? Which we would want everyone to see. But I know we must stop, but you talked about the training will include learning disability generally, health inequalities, red flags, and medication reviews. So it's kind of part of a package. It's not just about medication, is it really? So.
Yeah, and in some of the training we talked about positive behaviour support as well.
Indeed. Yeah. Thank you. Thanks, Shiva. Thank you. Thanks, everybody. That's our feedback.
Thanks. I probably will pass back to Michael, I think, for the close, but I just wanted to say thank you to everyone for joining, and that's just been such an amazing discussion and so many ideas and suggestions to come out from that. We've got a questionnaire for healthcare staff and families, so I'm just going to post a link to that in the chat for anyone who wants to fill it out. That's for our work, rather, it's not an evaluation for this just to clarify. And then if you want to get in contact with us, I'm putting in our email address as well.
Thank you. Thank you very much. Yeah, just urge everybody to complete that questionnaire. Really important. This work is critical. And thank you so much to VODG, NDTI, and Challenging Behaviour Foundation for today. Brilliant work, really important, and hopefully we can all continue to collaborate and make a difference to people's lives by reducing and eliminating the use of psychotropic medicines going forward. Thank you for everybody attending today. If you're interested, there's another session next Wednesday at the same time. Sign up is through Eventbrite again, and that's focused on training for NHS staff who would support people with learning disabilities, and that's facilitated by NDTI as well.